Good evening and welcome to HealthSmart. HealthSmart is a series of programs brought to you by Hudson Valley Hospital. Every month, a new guest, a new topic, and I'll be your host tonight. I'm Joanne Campbell. Tonight, we are excited to announce that we're in the radiology department of the hospital, and we're with Dr. Maurice Poplowski, who is the
Chairman of Radiology.
Chairman of Radiology, and Kathy Kiernan, who's the
Administrative Director for Diagnostic Imaging Services and Radiation Oncology.
Okay, so we got a lot to talk about, so we're just going to get going. It's Breast Cancer Awareness Month.
That's true.
And that's why we're filming, because we know it affects our community, and we know what an outstanding job the hospital does in helping with our diagnostic, making diagnosis and helping women get through this process. Do you want to open up and give us a little overview of your side of that story?
Sure. I guess one of the big things today is there's the controversy at what age a woman should get mammography. You know, traditionally, it's been at the age of 40. If a woman doesn't have any family history and there are no other risk factors, the age of 40 was the starting. Recently, there was a paper published from the U.S. Preventive Task Force. They said, no, the first one should be done at the age of 50. Well, that's obviously brought up a lot of controversy to the point where, people don't know what to do. A lot of women are coming in, questions, they're confused. Doctors are calling us very confused. What do you do? Well, I kind of take a common sense approach. It's very obvious. The goal is to catch cancer early. That's the best way of catching cancer and defeating it, is catching it early. 40 obviously is better than 50, if we could catch it early. And also, the U.S. government has said that, you know what? The Senate said they passed a mandate. No, not 50. We have to go by the 2002 guidelines, the age of 40, because I think they realized that it's a safer thing to do. Okay. We got to catch this thing early, and to the point where they said that insurance companies still have to pay, no matter what this preventive task force said. They still have to cover mammograms starting at the age of 40. And for those women at high risk, we have to do it earlier, either the age of 35 or 30. And they even recommend that getting MRIs for young women with the gene, those with the BRCA gene, people with the BRCA gene.
What makes a woman at risk?
At risk. Family history of cancer, having the gene for cancer, the cancer gene. Those are the two big risk factors. Early menarche there's a risk with that. I mean, the standard risk factors are there. Right. And again, we also encourage the most important thing is self-breast exam, and that we should start at very early age. We should teach our teenagers, once they start going to the gynecologist, they should be taught self-breast exams, the right way to do a self-breast exam, and to get those, because like we said, the early detection is the best chance of defeating this.
Right. And the value of self-breast exam, I think, for young gals, because we have a difficult enough time to get the older gals to be compliant with self-breast exams. So I think you really hit on something.
Yeah, if we could start it early, good habits, get them started early, and hopefully it'll carry out throughout their life.
Yeah. And what are the disease numbers looking like at this point in time as for breast cancer?
Well, still looking 1 out of 8 women risk of breast cancer, which is obviously high. I just look around in the room, you have 8 women. Someone. The great news is that with the new chemotherapies, our survival that's the key. The key is the new chemotherapies and the new treatments. That's really one of the keys here.
So surviving with cancer.
And I think what the task force failed to mention is the fact that between the ages of 40 and 50, there are still about, on average, 2,000 women that are found to have breast cancer based on the mammographies. So we're missing those 2,000 women between the ages of 40 and 50 if we're really actually going by what the task force is telling
us. At that new 50 age mark. Okay, so we want women in the community to know, step up, 40's your number again, and so, what kind of services are we offering here?
Right. Well, why don't we take a look at the digital room first?
Okay.
We can walk over to the digital room, and then we'll talk a little bit about the lounge area for patients waiting for mammographies.
Okay, very good.
Great. So we're going to
and so now we're actually in one of the mammography suites, and Liz Dwyer has joined us because she's the supervisor of our mammography program. So thanks for joining us. So tell us a little bit about the equipment that we're actually standing around now.
This is the Hologic Selenia Full Field Digital. The procedure for the patient feels basically the same. It's still an uncomfortable test, not painful, just slightly uncomfortable. Our end is very different because now it's digital. So it's a faster exam. We could retrieve the images immediately after taking them. And the radiologist end, Dr. D.
From our aspect, the machine has been shown to be better for young women, women with dense breasts. As you know, regular x-ray sometimes doesn't penetrate as well, so you have to get a repeated x-ray, which means a little bit more radiation. With the digital machine, it cuts back on that, so you don't have to do that extra film, that extra radiation. It's quicker, so it means that the mild discomfort that women experience, I haven't experienced it myself personally, but the mild discomfort is quicker, so it doesn't last as long, so they appreciate that. And for us reading it, I can tell you, interpreting it, it's much better. We see calcifications, we see things that we did not see on other films.
It also has an inherent iCAD system within the unit itself, so what that enables the radiologist to do is it almost highlights those areas that may be slightly suspicious, and it helps the radiologist look closer at those specific areas of the image.
Okay. And who makes the decision between digital and our great mammography we were doing, and continue to do? Who makes that
I
decision?
think basically the doctors that are involved with the patient's care, as well as the women, have the choice to decide. As Dr. Poplawski said, between the ages of 40 and 50, many women's breasts are very, very dense. With the digital mammography, it enables us to visualize the tissues a little bit better in those women. But basically, it's a choice for the women to make, as well as their doctors. Would you agree, Dr. Poplawski? Yeah.
And pretty much we know if they had a previous study that showed dense breasts, then we know we direct them then towards the digital mammogram so we can find a more sensitive test looking for, small cancers.
Okay. So digital is a little quicker, and the picture is obviously an improved image if the tissue is dense.
Correct.
Plus, you can save it. One of the big things is saving the image. In the old days, you had this film. With time, it breaks down. The film itself breaks down, and it's not a good image. Digital now, you can basically save it forever.
Yeah.
And you could send it anywhere. If you move and you will go to California, you could put it on a disc and have the very clear image taken with you.
Right.
So.
And you all do such a great job for anyone having their first or their 20th, in our women's suite. In our women's suite, really the lights are a little lower. We're not quite as bright as here, and you do a great job making it a very comfortable experience.
Well, thank you. Actually, I wanted to just mention our patient satisfaction scores for the mammography department through Press-Ganey is actually 99th% in the nation for the past year. So year to date, we've had approximately 574 patients send in their surveys stating that we are best in the nation. You cannot do better than Hudson Valley Hospital Center and our mammography program if you need to have a breast image done.
Funny that you'd want to mention that. Good job. All right.
Because of the dedicated, compassionate, genuinely compassionate staff we have here. They are amazing.
Okay.
Really amazing.
All right. Well, great job. And so now we're in the beautiful women's suite. That's part of the radiology department with Kathy and Liz. And tell us a little bit about the suite and how the suite came about. And, you can see it's just gorgeous.
Right. Well, we used to have just all of our women waiting in our main patient wait area. And we found that, it's a time for women that is quite stressful sometimes. They're feeling anxious, they're nervous, they're worried. We wanted to take them out of that environment and find a place where they could be really calmed by the nice lighting. It's soothing.